Hello, everyone. It's lovely being here with you. I'm Lucia Rocca-Ihenacho from City University of London and the Midwifery Unit Network. And today I'm going to talk to you about the importance of the environment in a midwife-led unit. So let's start by highlighting the importance that the physical environment plays in determining service users' experiences. And particularly in a midwifery unit, the environment influences and potentially promotes the health and well-being of women, birthing people, their family, and the staff working in the facilities. So what is a midwifery unit? It is a maternity unit which must be completely separate and defined, a defined space separate from the obstetric unit, which offers maternity care to healthy women with uncomplicated pregnancies. The midwife is the main care provider who works autonomously and collaborates with the multidisciplinary team when needed. Midwifery units must be centered on a biopsychosocial model of care, and we'll come back to this point later in the presentation. So midwifery units can be freestanding or alongside, and we also have a different type of unit called maternity home. So let's have a look how they look like. So these pictures are from midwifery units in the UK. And as you can see, there is a lot of attention towards the environment to be relaxing and friendly. So they look a little bit like a hotel, if you wish. And all the clinical equipment is tucked away in order not to trigger adrenaline production in the service users. And from these pictures, you can see how maternity homes look differently, look quite different. These look much more like a home, and they're often private. They're much smaller than a midwifery unit, and normally they are just a different way of offering birthplace setting, which is more similar, I would say, to home birth than a midwifery unit. If we have a quick overview of the evidence, this is the latest systematic review by Scarf et al. And is from 2018. And if we look at some of the conclusions of this review, as well as other research on midwifery units, we can say that midwifery units have improved maternal clinical outcomes, similar perinatal outcomes, better maternal experiences of care, and they also have great job satisfaction by midwives, and they're also less expensive. So if we look at all the evidence and the recommendations, the recommendations are that this provision of midwife-led settings should be expanded. There should be a systematic facilitation to support change. There should be a focus on interdisciplinary training and a shift towards considering midwife-led settings as the normal primary care pathway for women who are eligible. And this shift should be supported and facilitated, and we should have a whole system approach to change. I was talking earlier about the models of care. So we can see there are two opposites philosophies, if you want, underpinning the model of care on which is the basis for midwifery units, and what very often is associated with hospital care. So we talk about the biopsychosocial model of care, which takes into consideration the physical, psychological, and social needs of the woman and their family, versus the medical industrial model of care, which is based on a reductionist approach, which has a separation of body and mind, whereas the biopsychosocial model of care is offers a more holistic approach. So you can see by looking at the different elements in each of these models how they are really opposite. And you can understand how, if you have a midwifery unit, which is part of a wider maternity system, and the obstetric unit is based on the medical industrial model, you can see how this different way of conceiving maternity care can lead towards conflict. So it's very important that we train all maternity care providers focusing on the biopsychosocial model of care to avoid the creation of conflict and misunderstandings. These pictures are from my beloved Barkentine Birth Center, and I based my PhD work on this birth center. I explored the characteristics of a well-functioning midwifery unit by talking to staff, talking to service user, and also observing everyday care and activities at the birth center. And one of the models that came out from my PhD is reflected in this figure, which puts at the center of a well-functioning of a midwifery unit for staff and service users to be able to build relationships and trust, and also having a different approach and different power relations within the environment. These reflect also in the way the space is used and conceived. So as you can see from the pictures here, there is, as you get into the birth center, there is a large common area with sofas and little tables. And this area, the culture supports service users and staff getting together, have a cup of tea, enjoy the space. The kitchen is not a staff-only area. Service users are advised and suggested that they can use the kitchen to make themselves a cup of tea. So this really promotes this sense of relaxation and enjoying the space. Also, there is a lot of attention in the rooms not to have clinical equipment out and about, but for everything to be tucked away. I wanted to briefly talk to you about the Midwifery Unit Network, which was created in 2016. And the reason why we created it is because we felt there was a need to share, to learn from each other, to also tackle common barriers towards the well-functioning of midwifery units. And one of these certainly was looking after the environment of a midwifery unit. We focus on several activities, including networking and influencing. We offer training, consultancy. Many of us are involved with research with our universities. Particularly, we collaborate with City University of London. And in 2018, we released the first European midwifery unit standards, which were a huge effort to produce. It took more than a year to produce this document, reviewing all the evidence. And within these midwifery unit standards, there are 10 different themes. Please do explore the document. You can download it for free on midwiferyunitnetwork.org website. Theme 7 focuses on environment and facilities, and standards 15 to 19 specifically speak about standards for the environment of the birth center. So it states that midwifery units should offer an environment that promotes the biopsychosocial model of care and building relationships, supports mobilization and active birth, protects and promotes relaxation, privacy, and dignity. And Standard 19 stresses the importance of the midwifery unit being accessible and visible from the community. In 2016, we also started a project to explore initiatives and activities which can help the development and improvement of midwifery units. And one of the activities we proposed and experimented was called the walkabouts. The walkabouts are an activity for which service users and staff from a midwifery unit go around the birth center, and service users help the staff to have a fresh eye approach and look at their environment and identify areas for improvement. So just to give an example, these pictures are from a freestanding midwifery unit in England. And as you can see, the environment is quite cold and impersonal. So we did this first round, and then by engaging the staff of the birth center with 2 hours of work and collaboration with them without spending any money, this is the result. So you can see they actually had things tucked away in cupboards. So we helped them to take them out and to simply move things and make sure all the clinical equipment was tucked away. So this is a little suggestion of something you can easily do without really any cost to improve your midwifery unit. Regarding training, I just wanted to point out that we offer e-learning modules, and one module focuses is an introduction on midwifery units. And in being part of this conference, you can use the voucher NBC 2020 to access a 50% discount on the 4 e-learning modules. So please do go on our website and explore. We have also loads of resources which are free to access. So concluding this brief presentation, primary care midwifery, continuity of care, and community birth options should be crucial assets and are very important in improving maternal and child health. Midwifery units should be considered the normal primary care option for healthy women with uncomplicated pregnancies. We should focus more on the biopsychosocial model of care when we implement or want to improve a midwifery unit. Let's focus on power relations because they are so crucial on setting up the right organizational culture. Please do involve service users, and I hope you will organize walkabouts in your unit. And please do let us know how it goes, because we're really curious to know how it works for you. And work with all your stakeholders to identify individual barriers at individual level or system level. And then you can work with your stakeholders to identify solutions to overcome those barriers. And one of the key aspects is not to work in isolation, but as mentioned throughout the whole presentation, involve service users, involve service managers, involve all the stakeholders, including funders, because you want to make sure you have them all involved to make sure you have a good plan to improve and continuously improve your midwifery unit. I hope you enjoyed this presentation. You will be able to download a PDF version of this. I will provide it to the conference organizers, because you also have here at the end a whole list of references referred to the birth environment and also general references on midwifery units and optimal care. Thank you so much for your attention.